Are you currently under investigation for COVID, or have you recovered from COVID?
No, no.
Great. Any unexplained fatigue? Worsening of any chronic conditions?
No.
Yeah, first case would have been our third week of March, I believe. And grew significantly since that time. We had high volumes late March and the first couple of weeks of April. Interesting times, meaning these are very difficult patients. They're sick. They require aggressive supports. Worldwide, obviously, there's been a lot of experience, a lot of exposure to this disease, and a lot of people have not done well. So there's quite a lot of fear as well associated with the disease. Just the complexity of illness that's associated with the viral pneumonia. I mean, you can get anything from cardiac issues to blood clots to really, bad pulmonary problems in general. You can get strokes. Different patients can present very differently, symptom-wise as well. So it takes a lot of attention and clinical acumen. And so far, we've seen a wide population in terms of age that have been affected and even being admitted to the intensive care unit. There's a wide level of sickness. Some of the data coming out of the U.S. in particular is showing very high mortality rates. We haven't seen as high as they're reporting.
Do you have a range here?
Typically, here we've had in our ICU so far, we've had roughly about a 30% mortality.
And that is someone who comes into the ICU.
Ventilated.
That's ventilated.
Yeah.
So 70% of people ventilated are.
So far, however, it's still very early, and I would caution any interpretation from that at this time. But roughly in the 60 to 70% range are surviving so far.
Someone in their 30s was ventilated.
Yep.
Wow. So that's a real message. I mean, it is interesting. That's not what people think out there, right?
Right.
But it's not just the elderly.
It's not just the elderly. That's for sure.
Sort of anxiety and fear among staff members. That's an ongoing.
It is. I think it's important to be honest and open about that, and we've done that as an admin group here in the hospital, but also our frontline staff is also very open and honest about it. And the fears are multifaceted, and I think you also have to realize that this is quite an effect on everybody's lives as a whole, not just their work environment. There's fears that ranging from not having enough PPE, for example, which has been well documented in the news, to fears of handling patients who are infected, fears of getting infected. And so there's multiple levels of that. And I've said this many times, I mean, it's normal as an intensive care team to have a little bit of fear. We handle very sick patient populations and people on life support, and during desperate times for some of these patients. And we're used to that, but this is a different level.